Very good afternoon to all. First, I would like to thank the organizer, Dr. Vitull, for this opportunity. But the purpose of my presentation would be more better if, because it is about the integration and developing a good health system. And yesterday, I was there in ministry to for a workshop where we are planning to develop a good health system. So various clinicians and other departments were there to develop a climate change. What are the health impacts of those things? So this One Health approach is all about that, and that is we need collaboration, coordination, and communication between three important sectors, that is human health, animal health, and environmental health. So we cannot see this nowadays, these things alone. We need coordination. And every time we see in Kerala, every time they come up with a new cases like nymph virus or swine flu or something new, like monkeypox also they have detected recently. So their system is very well developed, and so this need coordination of all clinicians, whether in government sector or private sector, from the health side, and other sectors are also important for developing such things. And I am happy to inform that we are already running sentinel surveillance site from last 2 years, and now we are regional coordinating center for this region for National One Health Program for prevention and control of zoonosis. So under this program, we have strengthened our lab. So microbiology lab, now we have a capacity of diagnosing brucellosis, leptospirosis, and many more priority diseases. And every year we are increasing our facilities. But so as to identify these infections at the ground root level, so we'll get referral of these cases. Otherwise, these cases will be missed. Clinicians will simply diagnose a case of fever because lab facilities, if these are not available, then these cases will be missed. So we are planning to sensitize all the clinicians about these priority diseases so these are not missed. And proper history taking is also required so that if person is coming from some endemic area or from any endemic country, so one can suspect of these zoonotic diseases. So being a regional coordinating center, we are trying to invite all the stakeholders and agriculturists, veterinary surgeons, animal husbandry, fishery, so that if any unusual case is reported there, so if they will inform us or we will inform them, so with a proper coordination, we can easily diagnose such cases and early action can be taken. So what is the importance of One Health? Like most emerging infectious diseases, that is around 60% are zoonotic in origin. And out of these infectious diseases, if we see in last 3 decades, more than 30 new viruses have emerged. And these around 70 to 75% of these viruses originate from the wildlife or from the animal origin. And the other important thing is an estimated 1.7 million undiscovered viruses still exist in mammals, avian host, and almost half of which have the ability to infect. So there is a huge potential of epidemic lying there. So we have to recognize, we'll discuss more about what are the ways to discover these infections. So, and if you will see in last 20, 30 years, all the infections, major epidemics are due to the viral infections. And because of no immunity, every time we land up into a huge epidemics. Like uh, in last 10, 20 years, we have seen severe acute respiratory syndrome, SARS, in 2003, Ebola virus infection in 2005, and again in 2017, H1N1 flu, Zika virus, MERS, Nipah virus, COVID-19, monkeypox. So all these are viral in origin. And all these, there is no preparation of our health system because these infections are new to the system. So in this slide also you can see from last 20, 30 years, many such episodes happened, and our system is always overburdened with such cases. And there's a huge panic also in the community. So what are the factors responsible for disease emergence? Like wildlife forest encroachment. Usually now people are encroaching forest for uh, getting more space because of increased travel globally. So infections spread rapidly. Because of uh, intensive livestock farming practices and growing demand for protein-rich diet, we are dependent on such sources. Because of poor sanitation, because of environmental changes leading to increase in vector population. Again, the flu viruses, there is a chances of mutations. So that again increases the chances of newer infections. Then air pollution. Air pollution is a big factor for cardiovascular diseases now. Increased population, urban expansion, and land use change, deforestation. So all these factors, and these are anthropogenic factors, and all the infections we have seen in the last slide is due to our anthropogenic efforts that are not sudden, but it is due to our lifestyle. So due to human activity now at rural, urban, and mobile communities at local or national level, and if there is an imbalance between all these three, that is environment, human, and animal, then it can result in more such infection. Due to climate changes, with a 1 degree or 1.5 degree rise in temperature, there are increased chances of vector-borne diseases. So it increases the chances. So there is a need between coordination, communication, capacity building of our health worker is required so as to have a good One Health, that is healthy ecosystem, healthy humans, and healthy animals. So now there's a big umbrella, that is a proper coordination is required at every level, that is environmental health, ecology, veterinary medicine, public health, human medicine, molecular microbiology. So we cannot see now patient alone, but if any clinician is noticing any abnormal phenomena, unusual thing, then he should report to the health authorities like this is done in the Kerala. So every time they detect it quickly and take proper action, and that is how they subside the infection and control the infection. So all these infections due to zoonotic diseases and our health system like comparative medicine or translational medicine. So cancer, cardiovascular diseases in humans and animals, and environmental exposure, metabolic disorder, everything can be controlled by One Health approach. So the aim of this program is to respond to the zoonotic disease outbreak using a One Health approach. So multidisciplinary involvement is required with a relevant expertise for protecting people, animals, and economies. So in last few slides, I have focused more towards the infectious disease, but these infectious diseases alone is not under One Health, but since environment is involved, so it is beyond that, that is infectious, non-infectious, and injuries also are covered. So communicable, non-communicable, and injuries, everything is covered. Like and during winter months, due to lot of fog, a lot of accidents are being reported. So fog is a combination of water and dust. So this can cause, so we have to keep a control on our environment to reduce the injuries. So anthropogenic stressors to the environment enhance and exacerbate disease that animals mediate to humans. So in this sylvatic cycle, usually the animal viruses with a high host plasticity remain concentrated there, but because of interaction between the wild animals with the domestic animals or human activity at the wildlife, there is a spillover, and then stage 1 crosses to stage 2 and animal to human infection sets in, and then human to human transmission starts. So with increased mobility, a spillover event lead to multi-country or global threat. So what is needed? What are the preventive strategies so that we can reduce the infection from the wildlife to the domestic animal or to the humans? So we have to share the epidemiological data at various levels. We have to do routine testing of sentinel species, identifying and vaccinating high-risk group, and limit wildlife domestic contact with fences or planning around migratory routes. So no one is spared from this infection. So involvement of everyone is required for developing a good health system. So like in, again, this slide you can see, we need to sensitize, we have to develop a capacity of various sectors, and infection care models are now available. So we can predict infections in advance. Like if you want to contain the spread of dengue virus, now models are available through which we can predict 2 months in advance about such infections. So prediction is possible. So we can do good detection and control these well in advance. This is how we can improve our health system. So this is the strategy of developing the health system, but I think I'll skip it. This tells us how we can develop a consensus among various sectors. Political will is required, and how we can develop a good health system. So these are the preparedness strategy for zoonotic disease. These are 7 key strategies. That is strategic planning, financing, leadership, and governance. And we have to develop a collaborative surveillance. So collaborative surveillance not only at the health level, but also at the veterinary surgeons level, and reporting, cross-reporting is required. So that we can develop early warning systems. Through early warning, we can take adequate measures. So there is a need of workforce development. We have to develop our laboratories to tackle with such infections, newer infections. Hospital preparedness is required, and managing surge capacity, and always there is a scope of operational research, of developing a health system research models. In many of the states now, wastewater surveillance is in process. So wastewater surveillance, that is, they try to detect early through the sewage water, through the hospital waste. They detect the viruses and bacteria, uh, excessive use of drugs. So this sets in the early warning for infectious disease outbreak. So this system can also detect the multi-drug resistant pathogens. Uh, Under this environmental control, we can have a better surveillance of water and soil pollution so that we can detect arsenic poison or lead poisoning. So these factors also one has to keep in mind if certain symptoms are being reported, like hyperkeratosis or increased cancer risk, lung, bladder or kidney due to arsenic poisoning, or symptoms which are suggestive of lead poisoning. Again, air pollution, it enhances the chances of many respiratory infection and cardiovascular infection. So every time uh, uh, we notice air pollutants, so one can suspect, like in Delhi, there are more chances of uh, morbidity and mortality due to these factors. Okay. So if we'll stop such infections well in time, then we can reduce the cost of control outbreak. So what are the priority zoonotic diseases which are there in this program and which we are trying to develop at our laboratories? So zoonotic influenza, anthrax, Japanese encephalitis, leptospirosis, brucellosis, dengue, rabies, scrub typhus, plague, and CCHF. So these are the 10 priority diseases which are covered under One Health, and we are doing a hospital-based surveillance as well as surveillance at the community level. So there is a need of integration, and you can see the green zone, that is cross notification between the veterinary and health sector, that is human health. So again, you can see the green bars. On the one side there is a government system, and on another side there is a private sector. So we need to collaborate at various level. At district level, there is a proper coordination is required, so information can percolate from district to state and state to central surveillance unit. So again, the coordination is required at various level. So prevention, preparedness, and response is required. So PRP is required for prevention, so I will not take much time because time is already over. So there are few cases of, that is after flood, we can anticipate leptospira infection. After earthquake, which we have seen in Surat in 1994, there is a sudden rise of plague infection, bubonic plague. Then West Nile fever, salmonella infection after the party due to salmonella in the eggs. So after eating egg curry, one can notice gastroenteritis. So such things are there, and one has to be vigilant to cover these things. So again, with the cross notification, our system has identified avian influenza or Lyme's disease. So these are some of the vulnerabilities for respiratory pathogen, and respiratory pathogens are most rapidly spread, and all in the last decades, we have noticed viral infection, and most of these are respiratory infections. So these are some of the trigger points which increases the chances of suspicion or epidemic investigation. This is the combined chart which we can develop, and we can discuss later how we can detect these such infections in an integrated manner. So thank you.